Today on our show, we are joined by Dr. Rakhee Vakil, a distinguished homeopathic physician with nearly 3 decades of dedicated practice. A graduate of Yerala Homeopathic Medical College, Mumbai, and a fellow in advanced homeopathy, Dr. Vakil believes in a gentle, holistic approach to healing. From helping women navigate hormonal imbalances and PCOS to treating chronic ailments like diabetes, hypertension, and skin conditions, she's also played a vital role during the pandemic, providing prophylaxis to thousands and spreading awareness about preventive healthcare. Let's welcome Dr. Rakhee Vakil, whose mission is to help people press the reset button and live a life of balance, vitality, and joy. Welcome to ITV Gold, Rakhee.
Thank you so much for a warm welcome. Really appreciate.
Pleasure. So, Dr. Rakhee, you've been practicing homeopathy since 1996.
Yes.
What first inspired you to choose this holistic path instead of conventional medicine?
I myself was a very sick child, and my mom was a gynecologist. And my life turned around with homeopathy because I myself got very complicated with certain issues, health issues, and eventually she started me on homeopathy. And I used to take so much allopathic medicines that I used to almost puke every time. And when I was 8 years old, I thought that when a person is sick, you need the most gentler part of treatment and care, which really turned my life. And that is the time I decided that I will become a doctor and I'll get into homeopathy, and my name of the
Wow.
clinic will be Tender Touch, because you need the
Really?
most tenderness at that time when you're sick.
You
You
decided all that at the age of
age of
8?
8, yes,
Oh
because
my
I was very
God. How
sick.
much awareness you had.
Yes, actually, I went through a lot of treatments myself. So, swallowing those difficult pills, it was very difficult, putting the medicines in the banana and swallowing it
Oh
down the
my
throat,
God.
or
Yeah, I can
crushing or putting
imagine.
it in honey, and I have had all of it. So, it wasn't very pleasant at that time. So, then I thought that there's something more to this. And eventually, she just came across her friend who started treatment with me, and my life turned around with it. So I had decided that if at all I do something, I will get into the health industry and do some
Wow.
breakthrough work in my life.
And of course, those medicines, those little tiny pills, they
Yes.
taste so good and
Yes,
sweet.
yeah, they just make you feel happy and get you out of all the issues.
Okay. Homeopathy often emphasizes treating the root cause rather than the symptoms. How do you help patients understand this difference, especially in a fast paced world that wants instant results?
So basically, every person who has health issues do not come from nowhere. There are a lot of aspects to have any disease in your body. It starts with the mind, then circumstances, and eventually infection. Infection is pretty much in the air and anyone can contact it, but if there is a certain immunity in your body, every person will not catch infection. So if somebody sneezes in a train, there could be around 60, 70 people around that person who sneezed, and maybe only 2 or 3% will catch the infection. The other people can go scot free. So it depends on your immunity level as well, and how you think in life. What are your circumstances? Your mindset is a very important part of homeopathic treatment. We give the most important to your mind, your mental symptoms, and how you talk, how you think, how you behave, all of those things. That is a very crucial part, and we give most importance while we are taking the case. So we take the mental history, and it's given topmost importance in homeopathy.
Like I remember as a kid, I've always had this
Yeah,
chronic tonsillitis problem, and I
yeah,
went to a doctor, a homeopathic doctor,
yeah.
and she asked me, "Are you scared of dogs?" I'm like in my head, what has dogs got to do with my tonsils?
Yeah. So pretty much there are these remedies which specify that you have certain illnesses, and there are these remedies where you differentiate where if the patient is afraid of dogs or not afraid of dogs, and that's how you can specialize and give customized treatment to each and every patient. So if you have tonsillitis, somebody there could be different types of patients. For example, I can cite one is that some patients with heavy tonsillitis, the first symptom is throat pain, right? And some patients would be very comfortable drinking water, and some people may not be comfortable drinking water, and a solid food would be easier to swallow.
Oh, really?
So these are the minute differences wherein we get threats to pick up and prescribe.
But where does the dog factor come in?
The dog factor is just a part of it. It's like it's a mental symptom. It's not very important. There are a lot of other things. Dogs. So maybe when he is or she must have asked you this question, he might have found a remedy very close to this remedy. And to differentiate, he might have just asked you one specific question, that are you afraid of dogs? So if you say no that time, then he knows that you eliminate certain set of remedies, and the other set of remedies come in wherein you pick up your.
It sounds complicated though.
No.
Interesting. I'm intrigued, but
Yeah.
complicated.
Yeah. So there is a repertory basically where all these symptoms are. These are all proven. This is all in 1800s.
Wow.
When Dr. Samuel Hahnemann started this cure, and he was also allopathic practitioner, and eventually he discovered homeopathy. So it's not a new science, and that's how when COVID came, we didn't have to look for another drug. We had everything with us, and where we played an important role that time. So there was no need for proving a drug or getting a sure shot result in patients. To my luck and God's blessings and good skills of homeopathy knowledge, I have not lost a single patient in COVID, whosoever has come to me. So it's
So they were treated, they were like COVID free with your
they were
medicine?
completely COVID free. We have a lot of data. We have a lot of patients' records. We have videos. We have notes where patients, have written that we have got out of COVID completely without any allopathic drug, and just basic isolation and treatment.
So there was this Patanjali that also came up with a homeopathic set of drugs, right, during COVID.
Patanjali is Ayurvedic. It is not homeopathy.
Okay,
So
okay,
that's a
okay.
completely different thing altogether.
Okay.
Yeah.
So, but would you have vouched for that? Like it was
I,
treating
I do not
anything at
vouch
all?
for anything which is over the counter, because those are specifics. It may help you, it may not help you. So if it helps you, you will think, oh, it's good. But if it doesn't help you, you should not think that homeopathy didn't help me, because there are a lot of things that we need to eliminate to pick up your remedy and give it to you. So we need to totally customize your treatment. It cannot be that you pick up and you lose faith, because that's not what homeopathy is about.
But a lot of people lost faith in the vaccines also at that time. It did save some, but it
So
didn't
pretty
work
much,
for so many people.
let me tell you, my daughter is not vaccinated at all. And vaccine, every human person who is born on this earth, whether animals, birds, any being, is born with a natural immunity. And we just need to maintain that immunity. So it's not necessary for me that every person should be vaccinated. Not that I'm against vaccination, but at the
Are we
same
talking
time,
about the COVID vaccine or
I'm
any
just
other?
talking about general vaccine. I have not vaccinated my daughter also.
At all?
No,
Like
no,
since
no,
she
no.
was born?
No, she's not vaccinated at all. I had to give her the COVID vaccine because she went to study abroad, and that time that was mandatory, so I had no choice.
Oh.
But I had given, but otherwise she's not vaccinated.
And what about tetanus? If she fell during playing?
We have all those remedies to cover up
Wow.
everything. So pretty much she's been okay.
Do you have something that can take away the effect of all the vaccines I've taken over the
Yes,
years?
we do
Because
have.
Oh, yeah.
Even those patients who have taken vaccines, we try to give them some kind of a combating effect, which reduces the side effects of the other vaccines. But COVID vaccines have been given rampantly, and we see a lot of patients having a lot of respiratory disorders who never
Yeah,
had history
yeah.
of any disorders. So
And I don't know if it is true, but young people dying of heart attacks and
yes, pretty much.
especially in India
Yes.
or maybe everywhere, but in India, like it really, came into limelight.
I agree with you. I mean, but there is no specific news that says that, okay, this happens because of vaccine, but there is no other condition also that we see. So it's pretty much,
So can I detoxify myself with the COVID vaccine?
you can to a certain extent, but you cannot completely. I can't say that because it's been quite some time that you've taken the vaccine. The effect is already set in
Yeah,
the body.
yeah.
So it does good also, but it pretty much takes away good things from your body also, your
What
natural immunity.
about polio, measles, and mumps? Your daughter was
No,
not given any
no, no,
of the,
and lot of
not
other
even
patients
polio
also.
drops.
No, not even any vaccines, and lot of other patients apart from my daughter who have asked me that, okay, should we vaccinate or should we not? So those who have asked us, we have told them don't vaccinate, and they
Yeah.
still follow up, and they are almost 27, 28 years old now. Like that was the initial days of my practice, and they're all fit and fine.
I didn't have a choice otherwise,
I mean,
I
of
would.
course.
Yeah, and the school board also, they would require all the certificates and
I would tell you,
everything.
my daughter was crying that time when there was these vaccines given in school, and she used to be detained and put outside her class, and she would come back home crying,
Oh.
even in spite of giving a certificate that please do not vaccinate my daughter. So she would be kept aside, and the friends would also tease her. But um, I stuck to my principles,
Very
and she's
nice.
fine.
Great, great. You've treated a wide range of conditions from hormonal and gynec issues to kidney stones and skin disorders. Could you share a memorable recovery story that reaffirmed your faith in homeopathy?
There are a lot of patients who come with this uterine bleeding, heavy periods. There are a lot of factors to heavy bleeding. It's just not one fibroid, or there could be endometriosis. There are there are just genetic hormone imbalance because of which patients bleed heavily. There is nothing particular that you can say, but you have to screen the patients through everything and start the treatment. And we have a lot of cures in a lot of conditions which are surgical, and it reverses completely. We have records, we have patients,
Wow.
interviews taken after their treatment. Before treatment, we have sonography reports to show that they had fibroids and stuff, and it melts away. We have treated menopausal disorders. Hormonal imbalances are so rampant these days that, I mean, out of 10, maybe 6 girls have PCOS. So there are these cases which we have to take it up and treat them naturally. Otherwise, the doctors usually put them on OC pills and hormonal, to balance out their hormones, kind of.
Name some of the menopausal disorders.
Menopausal disorders, as in you have hot flushes, you put on a lot of weight, you put on weight around your abdomen, you have water retention, you have swelling of feet, you get very irritable. There are a lot of You have a lot of hair fall, and
And all this can be reversed?
everything can be reversed. And every patient will go through a different set of symptom in menopause. It's not that these are the standard
It's
ones,
not
but
like your menstruation will start again, right?
see, menopause is like, say, 1 year of no menstruation. So sometimes it may just say hi, hello in between and disappear again. But exactly, say, a period of 1 year of no menses will be a set of complete menopause. So definitely we have a lot of scope in treating menopausal women, because that's another phase of life where patients start having joint complaints, hair fall, loss of self esteem,
The
and
weight gain that can be
depression.
reversed.
Depression. Everything is all connected to each other, and it matters because menopause is, going through such a phase where usually the children are also in their teens. So there is a lot of conflict that happens in the house because of the hormonal imbalances that happen.
True.
And there are many women who don't understand what is going in their body, and they do not accept it because they've been working so much, and one point of time their output reduces suddenly, and they feel कि I am doing everything so normally, why is this happening to me? And they don't understand that they need that pause, and they need that space to combat all the symptoms and go through the phase smoothly. So one must consider taking homeopathy for menopause, because firstly it is very natural, secondly it has no side effects,
So
And
is it like a supplement one needs to take forever?
no, no, no. There is supplements are totally different. Like if there is a deficiency, say you have a B12 deficiency, or if you have a vitamin D deficiency, okay, the doctor prescribes you something. That's a supplement. But these are medicines, and medicines are not always drugs or chemicals which you require to take. These are simple treatments which are very, very natural, and they balance out. So what happens in this is that we do not give you direct hormones. We tap your hormone system to function in a natural way.
Oh.
So it takes a little while because there is no spoon feeding done. So we tap your immunity to work in a way, we tap your hormones to work in a natural way. That is the difference, that we tap your system to function naturally.
So how long you have to take these
See, there
medicines
is
then?
no fixed time line that, okay, this is a course and you have to complete. It depends on patients to patient. It depends on how you are responding to the treatment. Accordingly, we, set up that schedule kind of for each and every patient. It's no standard rule for everybody that you have to take this much and then you're done. And I wouldn't even suggest or prescribe any over the counter stuff. You please customize your own treatment. You give your history to a good senior practitioner who is experienced, and it'll give you miraculous results, I can assure you.
But there are homeopathic shops also. They have like, I think arnica and all
Yeah,
that.
yeah, yeah.
Does
The
that
basic
work or it
No,
doesn't?
no, it does work, but you should know when to use what, because now, as you generally said, that arnica helps so much, and it's such a common name in every
Yeah, yeah,
household.
yeah.
But I would just want to give you a takeaway tip, that arnica is important when you have falls, but only when you have blows or you have contusions or you have blue marks, and when the patient doesn't allow you to touch you, the pain increases on being touched. So that is one characteristic symptom of arnica. But if you happen to have a fall, or if you're working in the kitchen and you have a cut on your finger and you keep taking arnica, it's not going to help you. So you need a little guidance from a experienced doctor, a qualified doctor, to take medicines, because if there is a cut, then the treatment is different. If there is a blow, the treatment is different.
Yeah.
If the nerve is affected, the treatment is different. If the bone is affected, the treatment is different. And so this happens the same for the muscle, tendons, each and every part. We have special remedies with special
Wow.
action on it.
Wow.
Yeah.
And talking about headaches, like there is no instant cure for a headache with a homeopathy medicine, is it?
So we have such fantastic medicines for headache, but there is no awareness, very sad to say. Headaches are also caused to many, many reasons. People could have migraine, they could have some eye disorder because of which there could be a headache. Some people would just get a headache because of the sun. Some girls could get headache before the menses. There are a lot of reasons for headaches, and if we completely isolate that these are the PQRS, means peculiar, queer, rare, and strange. These are the symptoms that every person carries when they have any particular disease.
Okay.
So, say if somebody is having a splitting headache right now, and somebody is taking a Tylenol versus somebody taking homeopathy, I can say that it'll work faster than Tylenol.
Wow.
And
That's
you
a
can
very
take it
tall
every
claim.
15 minutes to reduce the intensity of the headache and the frequency of the headache. So when we have a patient of headache and they come to us, what we will work is on intensity and frequency. Once that settles, then we start giving the constitutional treatment, and then we try to clear the case. And that's how it
Okay.
works wonders.
What about the skeletal system or the joints when person gets older? Maybe the spine gets a little bent, maybe the knee joints are glued together. So, do you have any medicine that can give sort of a lubricant and kind of make your spine straight and
We
make you
have
walk
such
properly?
wonderful remedies, but I personally would suggest that lifestyle is most important. So, right from middle age to young age, or whenever you have the time, say after your 30s, you must take care of your life and what you eat, because health is not a destination, it is a journey. So each day counts. So I'm not saying you don't enjoy or do anything like that, but at that point of time, you cannot have health cannot happen overnight. So you must be very careful. So for spine curving and all that, once it is curved, there are certain things which are irreversible. What we can do, we can stagnate the process of getting it worsened. So, for example, if somebody is coming up with an osteoarthritis, what
Right.
happens in osteoarthritis? That two bones which are, having a cushion, the lubricant starts, I think it just gets dried up eventually. So the bones start coming closer to each other and they start rubbing against each other.
Right.
Once they start rubbing against each other or getting closer, the pain initiates. You cannot completely lubricate that area, but whatever lubrication is there, we can control it drying up, or eventually with treatment, the positioning and exercising and physio, everything holistically if done, we can really improvise the movement of the patient, and the life can be really altered, and really we can improve the quality of life to a very very great extent, which people are not aware of.
Before we started the interview, you also said that homeopathy can cure anything from
Cough to
cough to
cancer, cough to
cancer
cancer. Yes, cough to cancer.
and everything in between.
Yes, we have lot of treatments for every single disease that can happen in your body.
Wow. What about autism?
Yes, we have treatment for autism, but it cannot be reversed. And
Then
we
what is,
can,
why do you call it a treatment if you cannot reverse it?
because we can improve the quality of life of the patient, we can stagnate the progress of autism progressing. And we see 20 to 30% of changes in the patient's behavior and stuff. The other pathies have nothing to offer, I think. They just, probably put them in certain special rehab centers and all that. But whatever little we have to offer, we can. But I wouldn't say it reverses completely.
But cancer, you've had cases where it's gone.
Yeah, it has gone. Yes, there are certain patients with homeopathy. Sometimes it goes, depends on what stage the patient comes, what all treatments have they taken. There are a lot of permutation combinations when they come to us. But we've got fantastic results in cancer. But I must say this on this platform, that for whatever cancer, if somebody is suffering from, and if they are taking any chemo or radio, if they take homeopathy along with those, I would say that they would tolerate those sessions much better than what if we would not be on homeopathy. So if
Versus
somebody,
like if they just took morphine.
morphine also doesn't completely settle, because if the pain is that intense, I have seen patients completely uncomfortable with high doses of morphine as well.
Wow.
So that's where homeopathy comes in, that if you take certain medicines which are particularly suiting your constitution, the patients tolerate the therapies far better than what they would tolerate it otherwise.
What kind of cancers are we talking about? Like bone cancer, blood cancer, GBM?
Any cancer, it could be any cancer.
With the
Cancer is multiplication of
prognosis,
cells.
prognosis is like, okay, you've got like maybe a
So,
month or two to live.
so we can just improve quality of life in those cases where they have a month or two to live. We can just give them some medicines, because they'll keep on throwing symptoms here and there, and we keep on palliating those symptoms time and again. So instead of taking allopathic drugs, if they take natural treatments, they are a little relieved with pain, and somehow they respond a little better to homeopathy, with my experience with a number of cancer of cases that we've treated.
And the life,
Life span cannot be changed, but quality of life we can definitely work on.
whatever we can get.
Yeah.
You also use Bach flower therapy in your treatments, a lesser known but fascinating branch of holistic care. How do these remedies work emotionally and energetically to complement physical healing?
So, bark flower remedies are remedies which are made from flowers. These are concoction, and they're diluted in spring water, ideally, which carries natural energy. So, when there are few drops put on the patient's tongue, for an example, I have a patient who is very intelligent, very clever, and very smart. And anxiety builds in such a way that that child has to come first in the class, no matter what. Um, so before the examination, the child has anxiety and has a fear whether will be able to perform or not. So there are different permutation combinations where patients have anxiety. Some children will rush to the washroom before they have exam.
Right.
Some people will start having tremblings. Some patients may have cold hand and feet. Some people will start sweating. Some people are just confident and they just go and write. Um, there are some students who think that they know everything, but when they start writing, halfway they will forget something. And
Right.
then eventually they'll say, oh my God, I knew it, but that time I went blank. So there are these different stages where we can treat the patient with these natural remedies and we get fantastic results. Bark flower remedies we've used in newborn babies also, who
Oh,
keep
really?
crying without any reason. You don't know whether the baby has stomach ache or the baby is hungry or baby is feeling cold and they just keep crying. You just give a few drops of bark flower remedies mixed in mother's milk and you administer and you see fantastic results. And they are no chemicals, they are absolutely natural remedies. So we match the flower remedy symptoms with the symptoms of the patient and we administer.
Wow. In your seminars, you often talk about the connection between mindset, immunity, and lifestyle. What are some simple reset buttons people can press daily to achieve that balance?
Mindset, immunity, and lifestyle is all interconnected. And every person should give health as a priority if they want to achieve their goals and fulfill their dreams. Because I always tell every patient of mine health is not an overnight story, it is a journey. And if you want to reach the destination nicely, each and every day will be equally important. So if you happen to go to a party and indulge in something, no harm, indulge, be happy, but you have another week to follow wherein you can patch up those, flaws that you've had over the weekend, kind of. So, I mean, health is in your hands and you should live with positivity and eat healthy, eat in proportion. You can indulge, but proportion is the key. So if you get into something which is beyond limits for a day, then you have a day beyond to, balance it out. But wherever there is an imbalance beyond particular point of time, then the disease sets in. Dis-ease. So your body is not at ease. And every body will give you an alarming signal. And if you overlook that time and again, then you will throw up with symptoms left, right, and center.
Wow. You're also the secretary of the National Society for Clean Cities, supporting education for hundreds of children. How does this humanitarian side of your work connect to your philosophy of healing?
Basically, it's always been in my mind that if at all I happen to have free time, I'd like to give something back to the society in whatever little way I have. We
Beautiful.
have a Balwadi running at Bandra in Bombay, and
What is that?
it is an institution which takes care of education
Okay.
and we take care of medical stuff also.
Like
So
the street children?
street children, people from the slums, and we have a kind of a curriculum for them. So the children are
Wow.
below, like very young, and then after it's like a preschool, a little before preschool also. So eventually, then they go back to, once they are done, they get into proper schools. But these are underprivileged students, and we run a Balwadi. We have a good playground. So, whatever they are deprived of, they can get. We arrange donations wherein they can get proper meals, healthy food, which we
How
help them.
wonderful.
Yeah, so it's been very close to my heart, and I've been associated with the institute over 14 years now, but
Wow.
since 5 years, like actively on the board.
Very nice. Lastly, as someone who believes that happiness is health, how do you personally stay centered through singing, dancing, or spiritual practice while caring for others?
um, every person should develop their hobby and passion. along with your very active lifestyle and hectic work and a lot of stress. I don't think any person here is without stress. Stress is inevitable. But how that stress impacts on your mind and body is your key. So you are the one to see that how much stress seeps inside and how much you're able to dilute and take it forward. So each person has stress. You have to
What is
know
a
how to
stress
manage.
buster for you?
My stress buster is either playing a sport, going down cycling in my garden, or
Wow.
singing, or
Okay.
yeah,
That's a cue for you.
yeah.
Let's hear something from you.
Some I can sing a spiritual bhajan
Yes,
if at all.
please.
अच्युतं केशवं कृष्णदामोदरं रामनारायणं जानकीवल्लभं कौन कहते हैं भगवान आते नहीं कौन कहते हैं भगवान आते नहीं तुम मीरा के जैसे बुलाते नहीं तुम मीरा के जैसे बुलाते नहीं कौन कहते हैं संकट हटाते नहीं तुम विश्वास मन में जगाते नहीं तुम विश्वास मन में जगाते नहीं. Thank you.
Wow, you're a singing doctor. Wonderful. That was
It's my
beautiful.
therapy.
Beautiful. Thank you, Dr. Rakhee Vakil, for sharing your wisdom, compassion, and insights into how true healing begins within. We wish you continued success in helping people rediscover the joy of balanced living. Thank you so much for talking
Thank you
to
for
us.
having me on the show. Really, really enjoy talking to everyone. And I also just want to give a last message that
Yes.
do not self medicate yourself and approach a qualified doctor. And you can email us anytime. If you have any queries, we'll be happy to answer you back. And I will share my email ID and telephone number. But please do consider taking homeopathy over allopathic drugs. Of course, I'm not saying that homeopathy is the only thing, and allopathy is also inevitable. Sometimes you have to take, but people have this query that only homeopathy may not help me. So we can take both the things together.
So one more question. What about the substitute for antibiotic?
There is no substitute, but we can treat the patient completely without an antibiotic in the same amount of time or maybe even a shorter span of time. But there are cases, one should know where to draw the line. You know, you cannot blindly treat each and every patient saying that, okay, allopathy has no space. No, I am not for that. We need to assess, and that only a qualified doctor can understand that, okay, we can give the patient space to give both, or homeopathy can take over, or you just need an allopathy for some time and get back on treatment. So if you're confused, please approach, and without making conclusions or coming to any decisions that, okay, this will work or this doesn't work, because each patient has a different energy, each patient has different set of symptoms, and they need to be treated in that particular manner, which only a qualified physician into homeopathy will be able to assess.
Thank you so much for talking to us. Thank you.
Lovely being here. Thank you too.